And we're going to move on to the last person that I'm moderating. So Rutendo, you are next. Welcome. The space is yours.
Thank you so much, Ron. I just want to make sure you can see my screen.
We can see your screen.
All right. Good morning, everyone. And thank you so much to PathSA for having us. I am going to be specifically talking about how VITA-HI is delivering primary healthcare services for the transgender community using a multidisciplinary team approach. And my name is Rutendo Bothma. I am from VITA-HI within the Key Populations Program. And we are providing services for transgender people and female sex workers under the USAID and PEPFAR award. So this is my content of the presentation. I'm just going to share with you, I've got two other colleagues who are also presenting soon after me. So I'll talk a little bit about what their presentation is going to look like, and then give you a project overview, and then the rest of the content you can see on the slide here. So I've got Naomi and Jolie on the call, who are my colleagues within the Key Populations Program. I'm going to be focusing on the blue block, which is just describing our multidisciplinary team model, how we're working, and then share with you some of the results. I know that most of you on this call are already quite familiar with the VITA-HI transgender program, so I hope I'm not going to bore anyone, but I hope some of the information I'm going to share will be new and exciting for others. And then Naomi is going to share with you how we've incorporated our social worker services to drive the psychosocial support for transgender people, and just some of the results we're seeing from that. And then Jolie is going to then talk about how we've collaborated with other organizations like Gender Dynamics, She, around training and health competency for healthcare workers who are working within the gender-affirming healthcare space. So to start off, I'm just going to give you a very brief overview of our program award. So in 2018, PEPFAR through USAID awarded VITA-HI a grant called Advancing the South African HIV Response for Key Populations. And we were specifically awarded to work within the female sex worker population and the transgender population. And the overall objective was around HIV epidemic control. And this grant actually, initially it was extended to 2023, and we've just received another extension till December 2025. And then within that grant in 2019, we received what they called a Key Populations Investment Fund, which was an additional grant to look at how we actually accelerate the epidemic control, specifically working with other community-based organizations and CSOs and key population-led organizations. And Jolie is going to talk about this specific fund and how we use this fund to collaborate with other organizations around the peer support that I talked about. So most of you are familiar with where we're working, but for those who don't know, we've got 4 transgender sites across South Africa, in Hillbrow, in East London, in Port Elizabeth, and in Cape Town. And I think just what's important to note here is, you know, Bruno and everybody was talking about, and Land as well, when they were talking about bringing services at a primary healthcare level for transgender people. So to note here is that our East London site and our Port Elizabeth site are actually nested within a community health center within the Department of Health. And this was also deliberate for us to start looking at how we can actually incorporate these models within the Department of Health premises, but then just providing yet another evidence and model of care around having these services actually situated within the Department of Health. Historically and traditionally, you all know that most of these key populations programs that are funded by PEPFAR are usually verticalized. So they have drop-in centers or they have specialized clinics. So 2 of these clinics are actually situated within the Department of Health. And just, I mean, you know, everybody on this call understands this, but I just thought I would put this in here just around, you know, healthcare access, which, you know, my previous colleagues have already talked about. You know, the discrimination, the marginalization, but what also importantly is the inadequate healthcare practitioner knowledge and expertise, which I think, you know, several speakers have already alluded to around the need for competency training and gender affirming healthcare training. And surely later on, we'll speak a little bit about some of the work that we've done with gender dynamics. And then specifically for this presentation, I'm going to talk about, you know, the necessity for a multidisciplinary team approach to not only provide access to services, but to actually increasing service uptake within gender affirming healthcare model. So in terms of our approach to the healthcare services that we provide, we're very much a community-based program, and it's community-led by our peer educators, some of whom have elected to call themselves trans agents. And we're providing services at the standalone clinics that we've got, and some of them that I've already said are integrated within the DOH facilities. And then about 80 to 90% of our work is actually in the community, where our trans agents, our nurses, our community health workers are going out in mobile vans or with gazebos to provide healthcare services, specifically also around HIV testing, around looking at social and structural drivers for HIV, and also promoting healthcare access, and then referring people to different services if we are not able to provide that. And then a big component is also then the community-based services, which Naomi is going to speak about, around the social worker services and the psychosocial support. So in terms of how the site-based implementation team actually looks like, I've already talked about the peer support, which is really the transgender individuals who are working within our teams, who are linking people to our services or referring them to other services if we don't provide them. Some of them have formed part of our community advisory board, and some of them are making sure that they are reaching out to their social networks and informing them about our services and other adjunct services. And then we've got the social workers who are really driving the mental health supports and the counseling within the program. They are very much integrated within the HIV spectrum, but also very much integrated within the hormone therapy initiations, the gender affirming healthcare, and other referrals to Department of Social Development, to Home Affairs, to shelters, for example. And then we've got our professional nurses who are driving all of the clinical work, from primary healthcare to TB screening and referral for treatment, adherence support, and also supporting the risk reduction together with the social workers. And then we have sessional clinicians, sessional doctors, who are then responsible for monitoring bloods and initiating people on hormone therapy. And then they're working very closely with also sessional psychologists. And when I say sessional, just for everybody's understanding, is that they're not employed by Vitsarita permanently. They're usually coming into the clinics once a week. So following the gender affirming guidelines, the doctor, the psychologist, and the social workers and the professional nurses are working very closely together to provide these services. And then wherever possible and wherever we can, we then refer to different tertiary facilities for those people who may want to seek surgery. At the moment, I can't really talk to how many successful referrals they've been. In Cape Town, we work very closely with the folks at Fritoskia around this. And then Bruno already mentioned that we work closely with him as well around referring some of our people to Bara. And as he's already mentioned, it's not always rosy, and most of the time our people are actually not getting the surgeries that they require. So this table I just put in here, just, I mean, obviously you won't be able to read everything here, but it just gives a summary of, where our services are located, the actual services that we're providing, and, I'll make the slides available to anyone who then really wants to dig into the details. So what was important for us as a program is to also look at how do we actually integrate HIV services with gender affirming healthcare, which includes hormone therapy. And I know that one of the biggest pushback from the community is also around these HIV programs that really focus on HIV and PrEP and ART, and really kind of ignore the rest of the package that's, form part of this integrated health service package. So as a program, even though we are funded to provide HIV services, we are pushing and we're trying by all means to make sure that, the circles that you see there under gender affirming healthcare, around hormone therapy, referrals for surgery, but also importantly around the psychosocial support and the mental health counseling through our social worker and our psychologists are also part of that package. And then, as I said, wherever possible, we then refer for services that are out of the scope of our practice. So just a little bit on the data that we're seeing. So we started the program in October 2018. This is just some of the data that I've taken up until June 30. We are seeing about 600 contacts every month across the 4 sites. In terms of people that are tested and those that then are positive for HIV, we're seeing 14% of that. We have a very high uptake for pre-exposure prophylaxis for those people who are HIV negative, but do engage in vulnerable behaviors. And we've linked almost everybody who's tested positive to treatment. And we're seeing a really high result in terms of our viral load suppression. And Naomi is going to touch on this around how the social workers have also contributed to this. And this slide is just to demonstrate how hormone therapy, as everybody has mentioned, Landon mentioned this quite a lot around how hormone therapy, really does provide increased uptake for services, but also make sure that people do stay in care. So we're seeing that in terms of viral load suppression, which is really what we want to see when we're talking about epidemic control. People that are initiated on hormone therapy actually have a higher viral load suppression compared to those who don't. And in a recent paper that we've published, we saw that those that are on hormone therapy are about 3 times more likely to be suppressed than those who are not. And to date, we've got 578 people who are initiated on hormone therapy. That number has increased slightly. We are still short of hormone therapy, specifically in Johannesburg, where we've got quite a long list of people waiting for therapy, and the list is now just over 300. And we are trying to negotiate with our tertiary facilities, but as Bruno mentioned, they actually have much less people on hormone therapy than we do. And I'm just going to quickly talk about, as much as this multidisciplinary team is really an ideal model, it obviously comes with its own challenges just around, we've already talked about how a lot of the professionals that we have within South Africa are still not really trained in gender affirming healthcare. So bringing these people into the team always requires then consistent and continuous training. We are still struggling, as Madeleine said, in some of the districts to just get buy-in for this multidisciplinary approach within a primary healthcare level, but specifically supporting supply of hormone therapy. And just in conclusion to say, we have seen that this multidisciplinary team is really effective in delivering services. We do want to start looking at this in terms of the centers of excellence that the Department of Health are building, which really centers around the Department of Health facilities to provide services for key populations, and they're calling them the centers of excellence. So we do want to see this model really being piloted and being scaled up to those services, and making sure that hormone therapy and gender affirming healthcare are provided at that primary healthcare level. And thank you very much, everybody, for listening. I'll hand over back to you, Ron.
Thank you so much, Rutendo, for that very tight and detailed presentation. Rutendo, question, do you think it would work well if we let the 3 bits RHI presentations happen and then we engage in a Q&A at that point, or would you prefer to take questions now?
That is a very good idea, because I feel that some of the questions that might come up, Naomi and Jolie might cover them. So I would prefer that. Thank you, Ron.
Excellent. No, it's a pleasure.